This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is another elderly lady with an ultra hard cataract, and I'm going to critique myself in this video and just wanted to show you could have been done much better in this case. The marking for the planned toric lens is already done, incisions are made, the capsule is stained, the eye is filled with OVD. The first consideration for us to having a very big rhexis. A larger rhexis will definitely help us to minimize the trauma to the capsular bag when you're doing lateral separation. So in all ultra hard cataracts, it's always safer to have a bigger rhexis. And that's what I'm aiming at. I'm aiming at least 6mm rhexis, and that's what I get. So rhexis is done with, and now is the time to do hydrodissection. Hydrodissection has to be extremely gentle, using very little amount of fluid so that we don't build up any pressure posterior to the nucleus, because these posterior capsules are extremely thin. So we need to be mindful of this. The nucleus rotation is confirmed and time to emulsify the nucleus. So as you all must be aware now, my preference for dealing with such cataracts has been the 4-quadrant technique of late because I can use the cutting efficiency of the torsional ultrasound without generating much of an heat, and it can be very predictable. However, if things are not done well, we may have some difficulty. That's what I would want to show in this case. The nucleus is stabilized with the second instrument and the sculpting is begun. Mind you, the exposed tip is slightly longer. This helps us to get into the more deeper part of the nucleus effortlessly, and also we can create longer grooves across. Since the sleeve is far away from the tip, we can have slightly narrower trenches. So the three advantages of having a longer exposure tip: one is the jackhammer effect, or the cutting efficiency is better. The second is there is a deeper reach to the substance of nucleus with the tip itself. Third point, because the sleeve doesn't come in the way, we can get a narrower trench along with a longer one. The nucleus is sequentially rotated. I'm using both the instruments to rotate the nucleus. This is a better way to rotate the nucleus, as we're going to impart lesser stress on the zonules. So the grooves are getting progressively deepened, and as I get deeper and deeper, I feel that it's still not deep enough. So I continue to trench along the 4 grooves, and hopefully by this time I feel that the trenches are good enough. And let us see whether my judgment is right. At this moment, I feel that the trenches are deep enough. It must be around 80-85%, and I thought this should be good enough to crack. So the chamber is refilled with OVD, both dispersive beneath the cornea and HPMC under it. And now is the time to do lateral separation. In this case, I've chosen 2 Sinskey hooks, longer ones, to do the lateral separation. And by the time I introduce the instrument into the groove, I realize now that the grooves might not be actually deep enough. So I might struggle. That is what is my fear now. And as you can see, the amount of force which is required to separate is significantly higher. Nevertheless, the separation is there, but it is not through and through. The nucleus is rotated and the lateral separation maneuvers are being continued. It's very obvious that the amount of force which is required to separate them is quite more. You can see both these Sinskey are coming almost nearer the rhexis margin. And obviously having a very big rhexis is very helpful in such situations. I'm not going to tug at the rhexis margin. But nevertheless, the one thing which I could have done better in this case was having a deeper grooves. If we have deeper grooves, it ensures that we don't have to use more physical force to mechanically separate them. So that was one thing which I would have done differently. Obviously, I could have been a little bit more closer to the posterior plate. So the lesson which I learned from this case was it's very critical that in such situations, I think we need to be 90% to 95% deep enough. It's just 80% and 85% depth is not good enough. So I'm spending a lot of time with mechanical separation in these cases before eventually I go in and do phaco. So eventually I think that at least one fragment is free, and I'm just going to maneuver it using the two sync into the central safe zones so that I can then begin my emulsification. It's important for us to break the jigsaw puzzle in the bag. Once the first piece comes out, dealing with the subsequent pieces is not going to be tough at all. Now these are two big fragments, and because they're joined at some point in the poster plate, when I'm trying to maneuver one piece, the other piece also comes out. Somehow I'm just trying to separate these two fragments and trying to deal with one at a time. It's important for me to be very careful not to be very close to the cornea. So my dialer, I kept it in front of the fragment. So this ensures that I maintain certain space away from the endothelium and also prevent any nuclear fragment flying away and hitting the endothelium. So again, patience is a great virtue to have in such situations. So eventually the one fragment on top is emulsified. And then this is the time for the second quadrant. Again, the emulsification is done in a very controlled manner. See, the corneal injury is predominantly because of the mechanical trauma to the endothelium. So if we are careful to minimize turbulence, then we can definitely have a clearer cornea on day one. Now this is the second heminucleus. We can clearly see that some part of the posterior plate is still attached. It's not totally through and through free. After injecting dispersive OVD under the corneal endothelium, I'm injecting HPMC in the bag. This is a modified soft shell technique which I practice. Since QQ is used to mobilize the nucleus, then I want to break this bridge which is holding these two fragments together. So just go in with my phaco tip. Gentle phaco power ensures that the bridge is snapped and both the fragments are free. Once both the fragments are free, again, consuming them is not difficult at all. It's important to have these fragments free because if you have a very large nuclear fragment, then it's more likely to touch some part of the endothelium and cause endothelial damage. So it's important that we have a slightly smaller fragment. Smaller the better. Now it's very clearly visible that nucleus is just dancing around the tip. There is hardly any turbulence. I'm going very slow with the phaco power, and you can see just the nucleus fragment is just dancing around the phaco tip until eventually it just disappears. So the third fragment is also out now. Now I'm left with one last fragment. Again, I come back and inject OVD, the same modified soft shell technique. The principle which I follow in such ultra hard cataracts is that after removing every fragment, I go in and replenish OVD. This is the best way to prevent endothelial damage and have crystal clear corneas on the first post-op day. The final piece of the nucleus is emulsified quite easily. The cortex is aspirated, the lens is placed into the bag. OVD both in front and behind the nucleus is aspirated out, and time to align the lens. The lens is aligned, and that's it, the case is done. So these are the post-op day pictures, the day 1 and day 3, and she is doing pretty well. So the lesson which we learned from this case is it's extremely important for us to have a good sense of the depth of the groove, especially in such ultra-hard cataracts. So in this case, the depth was probably 80%. It just shows that such cases, it's not good enough. We need to be 90% deep, and definitely once we are deeper, it's very easy to separate, as is shown in this previous cases, wherein the lateral separation maneuvers are relatively much more easier compared to this. Whenever we are having difficulty in lateral separation, what we do is we end up using excessive force, and you can see that the instruments are going too far away across, almost nearing the rhexis margin. So this can be minimized if you have an appropriate deep groove to begin with. Of course, the second thing is it's always safer to have a larger excess in this. So these are the two important points. That's it for today. Thank you for watching.